the pushy broad from the Bronx, New York. Follow her voice, a straight dog is nice. She's a pushy broad from the Bronx, oh yeah. Don't be surprised if you wanna listen twice. Make decisions, find the right choice. Know yourself better, find your own voice. It's okay if you need help today, cause everybody needs a little push. From the pushy broad from the Bronx, New York.
Welcome, Transformation Talk Network listeners. My name is Ellen Stewart, and I am the pushy broad from the Bronx. Welcome to my show, Recovery Recharged, where we share advice and support from experts in addiction and recovery and life. I am so thrilled to have this expert with us today because this is a subject that is near and dear to my heart. And I know all of you parents out there will find it the same, especially since this is September and it's National Recovery Month and your kids are back in school and we have to think about whether or not they are struggling with substance misuse. So I thought we should get a jump on this, get the expert in front of us so that you know in the beginning what to look for and what resources are available to help. So my expert today is Kate Appleman. Kate is the Executive Vice President for Clinical Programming at Caron Treatment Center's Wernersville, Pennsylvania campus. She's been with Caron since 2002. She's held various clinical and leadership positions, most recently serving as the Corporate Director of Clinical Practice and Professional Development. She also has been actively involved in the development of evidence-based clinical programming for professionals, LGBTQIA plus individuals, and those with an opioid addiction. She is definitely an expert in adolescent substance misuse and, more importantly, adolescent recovery. So the Pushy Broad from the Bronx and Recovery Recharged is thrilled to introduce to you Kate Appleman. Good morning, Kate. How are you?
I'm good. Thank you so much for having me.
This is so wonderful. Okay, I want to get right into it. First of all, I know that adolescents have been on the Caron campus for a while, and I know that you haven't had adolescents for a little while. So let's just talk about that because Caron is returning to adolescent treatment. So can you speak to why you are returning?
Absolutely. Because when we look at the importance of adolescent treatment, it's a population that we get a lot of calls about. Adolescents need a lot of support. And as we look at some of the successes that we've had in the treatment of our young adult population, being able to open a small but mighty unit for adolescent boys and adolescent girls is something that felt really important to us. So we opened 8 beds for adolescent boys and 4 beds for adolescent girls to get started.
And when did that actually start?
That started the middle of July. So we are about 5 weeks in at this point.
All right. So what are you seeing? What challenges do adolescents face compared to adults? How is it different?
It's different in a lot of ways. Just starting with the brain development standpoint, their brains aren't developed the way adults are. We all know that to be true. So when you think about abstract reasoning, the ability to have impulse control, the ability to self-regulate, there's a lot of reasons why adolescents present to treatment differently than adults do. And that means that the way that we provide treatment also needs to be different.
So have you stepped up? You had a wonderful adolescent program. What new and innovative things are coming to the table now with this new program?
Well, we're seeing some differences in our society that then play a role in the way adolescents come through a family system, plays a role in how their addiction is presenting, and also then plays a role in the way that we treat them. So a couple of things that I think have changed are the substances that we're seeing and the ways that adolescents are utilizing them. That's changed. Historically, we've really looked at adolescents and their use of alcohol and cocaine as kind of two primary substances that we've seen them using. And as you can imagine, with vaping and with other factors, cannabis and hallucinogens are primary substances that we're seeing now. And the treatment of them have some similarities, and some of the cognitive issues and the psychological issues that come with high potency cannabis and hallucinogens kind of change what we see in treatment and how it is that we need to treat them. I think the only other two things that I would say is the use of technology continues to evolve over time. So technology can be a source for recovery and a way to advocate and really support recovery. It could also be a vehicle to help continue to support addiction. So we have worked really hard to leverage technology and really help support people that are not just struggling with substances, but also really support adolescents who struggle with mental health, gaming, gambling, technology, all of those pieces, because many of them come in with addictive traits of all of them.
So what you're looking at maybe is a few other things that you have seen before, but certainly exacerbated. And you turned around and said also that there are different kinds of substances, and this presents a real problem. So let's talk a little bit about the mental health aspect. Let's talk about the peer influences and how this impacts an adolescent journey. How do they come to you? Let's talk about that.
So typically adolescents come as a result of something either in the family system or the education system that raises a flag, right? They may see smoke, but they can't quite find the fire, right? So we know that substance use and misuse in adolescence many times comes out looking like anxiety, looking like depression, anger issues and outbursts, right? So when we have parents and school systems that are seeing some of those elements, those are the people that are really referring patients into treatment. The other population that refers patients into treatment is a lot of outpatient therapists. So when family members or schools are seeing symptoms that they can't quite put their finger on, many times adolescents start with individual therapists that are helping to really identify what's going on. So I would say that the three main ways that we meet adolescents is through school, family, and private practitioners.
And then, of course, it's the normal resistance that comes from that. Do you find that when they come into treatment, they're resigned and surrendered, or you have a problem with rebellion?
So I think that comes on a spectrum. I think that what typically will happen is that the family's goals or what they see as being the problem isn't always necessarily what the patient sees as being the problem, which is fine because I think everyone in the system is allowed to have their own goals. So when we think about resistance, it's really important to meet them where they're at. If they want to be able to socialize without the use of substances, or they want to be able to get a scholarship to play college sports, if those are their goals, we start there and then really start talking about the relationship that substances and mental health struggles have with those goals. Are their behaviors getting them closer to or further away from what it is that they want? And we find that many times with adolescents, they may not have longer term goals, but they have shorter term goals. So the ability to really understand what that is only happens when you establish rapport with them. And that occurs when you meet them where they're at. So when you talk about resistance or rebellion, I think it depends on how you meet them. They'll give you the amount of resistance and rebellion depending on how you meet them.
I understand. And how long can they spend with you?
Yeah, that's a good question. So we thought it was really important, which is another differentiator from our previous teen or adolescent program. We think it's important for teens to have access to care. There are a lot of teenagers that need a lot of help out there. For, being a teenager in and of itself is incredibly difficult. And when you add substances and mental health disorders on top of that, they just need a lot of support. And there's not enough places that do it. So we thought access to care would be really important. And to do that, we need to make sure that we're taking enough insurance to be able to put that into play. We typically are seeing a 4 to 5 week length of stay. And then we look at next level of care as what makes the most sense for that transition. If teens need treatment further than 3 to 5 weeks, we really help leverage some of our treatment partners that have longer term programs. There are also possibilities for teens to return home into a school setting with a lot of wraparound services that are specific to that population. So it really depends on what we see here as far as next steps, but our typical length of stay is between 3 and 5 weeks.
So a child comes in for treatment and they don't know what to expect and they don't know how to interact. What kind of treatment modalities are you using on adolescents? And also, I want you to speak to whether or not they get an education while they're away.
Yeah, so that's a really good question. So when we think about some of the top modalities, the first one I would put out there is motivational interviewing. And if any therapists are listening to this, they'll probably shake their head because the truth is, if we don't know what motivates them, they're not going to listen to us. So motivational interviewing is one of the best practice evidence-based therapeutic modalities for adolescents and adults, for anyone who's looking for any sort of change and for us to understand their goals. When we think about some of the other nuances of adolescents in treatment, we know that from a developmental standpoint, their ability to self-regulate the emotions that come up, to be able to identify what they are and know how to handle them in a productive way is challenging because they are in a position where they haven't really kind of lifted that muscle, so to speak. Dialectic behavioral therapy is great for that. So we do a lot of DBT here. We do experiential counseling and adventure-based counseling, because you can imagine a 16 or a 17-year-old sitting in group and individual sessions all day can be a struggle, right? School systems know that first-handedly. So we try to make a lot of our groups adventure-based and do some experiential work with them so they can understand things in a little bit of a different way. And then obviously cognitive behavioral therapy for them to be able to slow down and really start to exercise reflection and critical thinking and all of those elements that naturally progress through being a teenager that just need a little more help when you put substance use and mental health issues on board as well.
And I'm sure mindfulness is key as well.
100%. Yeah.
I always say to my clients, wherever your feet are, that's where your brain has to be.
Yes.
So it really works very well. So let's talk about the co-occurring disorders. They come in with substance use. You are helping them go through this. Do you find that adolescents need a detox most of the time or not?
Most of the time, not necessarily most of the time, and some do. So typically when you think about hallucinogens and a cannabis use disorder, for cannabis use, depending on the potency, they may go through withdrawal, but it may not be withdrawal that's needed for a detox stay, depending on the length and severity of their use. We do have adolescents that will come in with an opioid use disorder. There's fentanyl in a lot of the things that that they're putting into their bodies. So there are times when that occurs. Some of it needs medical detox, which we have on our care on campus. Some of it are withdrawal symptoms that they're able to be in a milieu and be able to work on coping skills to reduce.
So for all of those parents out there who turn around and say, this is a phase, my kid is going to do this for a little while. I did the same thing. It didn't turn into anything. What are the warning signs? What are the red flags? What are the things they have to watch out for?
Sure, that's a really great question. Adolescents are hardwired to be curious about things, right? They're hardwired to be curious. So I think when we talk about the concept of just saying no, I think it's a nice concept. And I also think that when curiosity comes to be a part of the picture, another part of the element is hold off as long as you can. Just wait, right? Your brain's still developing. Why don't you just wait before you get curious with your hands, right? And I think that when you see the warning signs that go beyond curiosity, you're seeing things like activities of daily living starting to be, they're impacted, having trouble getting out of bed, having trouble getting to school and getting to activities that typically would excite them. You see the typical changes in friend group, the friend group that they've had for a long period of time, those friends start to change and you find yourself not really knowing who they are as well as a parent. Significant mood changes. And when I say that, you know, going through puberty and the hormones that come along with it, you're going to get mood changes. But there's a difference between mood dysregularity versus mood dysregularity, right? So I think when you look at some of those elements, those are some warning signs. There's physical warning signs. When you have a teenager who typically will be able to look you in the eye and they're not able to do so anymore, right? Their eyes are bloodshot. They become more protective of their phones. They become more protective of their rooms. All of those pieces, I think, really are they're warning signs. They're the smoke, and you're trying to figure out what the fire is.
And most of the time, if you see the smoke, there's a fire, wouldn't you say?
Most of the time, absolutely.
I've also found dealing with adolescents when they come out of treatment and also putting some adolescents into treatment that there are some definitive differences between adolescent boys and adolescent girls. For adolescent boys, it's sometimes so obvious because they're doing something that's going to get them in trouble. They're going to be close to expulsion, or they're going to be arrested, or they're going to do something that will involve a principal or a teacher, whereas girls tend to be a little bit more hidden. Would you say that was true?
I would say that's true typically. I think what has a tendency to happen, not all the time, but many times, is boys will act outward and girls have a tendency to act inward. So some of the examples that you gave are good examples of that. You think about outbursts or anger or aggression or yelling, things like that, that outward piece. And what's happening is they inside are feeling dysfunctional and they're feeling like they're out of control. And then you start to see that on the outside, right? So when you look at behaviors, one of the things that really comes to mind for me is our patients aren't giving us a hard time, they're having a hard time, right? And I think for parents, you know, adolescents aren't giving us a hard time, they're just having a hard time, right?
That's
And
marvelous.
when you think about female patients, typically, they will typically act inward. And what that means is looking at isolation, self-harm, making changes to our eating habits, whether it's eating too much, eating too little, but not taking care of our bodies in that way. So when they have those feelings on the inside, they act inward and hurt themselves as a result of those feelings.
I've also found from the clients that I have been with that some people say, my child is doing well. He gets straight A's. He's on this club and that club and everything's fine, only to find out that the pressure of doing all of those things in the mind of that adolescent can drive them to do things that would be a danger to them. So the overachievers are ones also that you have to take a second look at. Do you find that too?
Absolutely. When you look at family systems, we talk a lot in counseling about how everyone plays their role, right? If you think about it as a lifelong play, we all have our roles and our parts. And when you look at people that, you know, can be a scapegoat that, you know, on the outside, they look like they don't have it together and it's easy to point the finger at them. When you look at somebody who is an overachiever, the amount of stress that comes along with that is pretty significant. And what we find in some of the family counseling that we do with teens is the importance of really looking at the roles that that family members play in the midst of that. many teens and young adults have a really hard time having that conversation with their parents because their parents have really had high expectations for them because they love them, because they want what's best for them. And sometimes the way that that kids interpret that, they hear that message in a way that creates more weight that sometimes parents weren't even intending for it to create. But if we don't have an environment through family counseling and treatment, specific treatment modalities, we don't set up the space for people to have those conversations, to create the space to not be perfect, to create the space to make mistakes, and to say, I can't do this, I need help. Sometimes being able to support people in having those conversations is really important.
So you have quite a few family sessions to make sure that parents understand that their child isn't going to be fixed, and a 3 or 4 week stay is not going to cure that child, but it's the beginning of understanding addiction and understanding, more than everything else, the family role in this. Is that right?
Yes, absolutely. And to your point, I think we look at this as the beginning part of a journey. And many times we think about the analogy of, we're kind of writing the book of our life, and sometimes coming into treatment is the start of the next chapter. Many times getting into recovery for people is almost like a plot twist. But decisions have to be made, and supports and progress and change to be able to really allow people to step into the journey of recovery. So this absolutely is the first step. And we find that furthering education and support and providing context to what recovery looks like for teens is really important for them and their families. Because when we look at the important role that parents play in continuing to raise their teenagers, they play such an integral role in that moment in their lives. Sometimes we put a lot of weight and merit on how much their friends are such an influence. That is true, and their parents are very much an influence. So for them to be along for the ride and really a key supporter, I think is really important.
Absolutely. And I know that there are other things in the life of a teenager today that they may be apprehensive about coming home to. Let's just talk briefly about the role technology seems to play and all of the challenges that young adults face after treatment.
So the role of technology, I look at technology as a double-edged sword. I think that generationally, if you're not in that generation, you can trash technology in a lot of ways. And the truth is, it's a form of communication for them. So instead of us continuing to believe that they need to do it a certain way, we need to leverage their language. So what that means is the importance of having recovery apps, of having recovery meetings, of social influencers and people on TikTok really looking at the pros of being in recovery. There's so much on TikTok around, vaping and gaming and gambling and all those pieces. There's also a lot of influence of young people getting into recovery and really staying in recovery. That generation advocacy for that generation is really important. So sometimes when you look at getting into recovery, it's putting a social network around them that has similar values and similarities in recovery. If we give them that social network and empower them to really own what recovery looks like for them and their journey, it's okay for them to really lean into that change and maybe have a platform that helps support someone else wanting to change. There's a big misconception that all teenagers use substances, right? A big misconception of that. And the truth is, the statistics around the amount of high school students that use substances has actually gone down in the past several years. Not everyone uses. And sometimes when teens, they're in that lifestyle, they have this perception that it's just normal. And the truth is it's not. There's a lot of people that don't use. There's a lot of young people that are in recovery. Part of our job as treatment providers is to make sure that we're navigating them to the right people that can help them in early recovery.
I think you're 100% right. Get them more involved in recovery programming to be a part of something. There are 27 million of us in long-term recovery, and this also tells them that there are a lot of people out there just like them. So I have about 30 seconds left. Leave us with a message. Tell us where to find the treatment. Tell us where to go. Where's the website? And leave us with a message to parents, please.
Absolutely. So the message I would leave to parents is you're not alone. When you are in the midst of your household and you don't know what to do and you don't know what's going on, and if you pause, you know there's something there, but you just can't put your finger on it. Know a couple things. One, you are not alone. Two, there are lots of people out there that can help you. I work for Karen Treatment Centers, www.karen.org. If you give us a call, we can help sort through some of that. If we're not the right place for you, we'll get you to where you need to go because we value recovery and treatment. If we're not the right place, that is okay. I would also say that it's really important for you to take care of yourself and to get connected to other people who've been through what you're going through. So the importance of family support networks and alumni networks, we have all of that for family. You're not alone in this. If you give us a call, we can help support you through some of it.
Fantastic. Thank you so much, Kate, for being here today. It's Karen, CARON.org, a phenomenal adolescent program. Please check them out. Don't ignore the warning signs. Thank you so much, and we'll see you next time. This is Ellen Stewart, the Pushy Broad from the Bronx, saying thanks for listening, and remember, everybody needs a little push.
From the pushy broad from the Bronx, New York.